So when I was 8 years old, I remember writing my dad a letter while he was in the hospital recovering from a heart attack. He was 33 at the time. And what I didn't realize when I was 8 was the impact of ischemia reperfusion on patients' long-term health after such a traumatic event. I appreciate that more now. And what we're doing at Bluegrass Pharmaceuticals is developing therapeutics to treat ischemia reperfusion. And so we're interested in ischemia reperfusion in multiple organ systems. This is acute kidney injury, heart attack, and also lung fibrosis. And we had a wonderful opening about acute kidney injury and the long-term complications with acute kidney injury that lead to chronic kidney disease. The same thing occurs in the heart and in the lungs. And with acute kidney injury, there's in the US 2 million patients annually that progress to chronic kidney disease. The other complication with these events is that an ischemic event or an ischemic reperfusion event in one organ system can also lead to additional complications in other organ systems. So our solution at Bluegrass Pharmaceuticals is a liposomal formulation containing an immune modulator that shifts immune cells from a pro-inflammatory to a reparative phenotype. And by doing this, we're able to improve survival in mice, reduce inflammation. We get tissue-specific delivery to the site of inflammation so that we have target enhancement and enhanced repair. And so the way that this works is there's inflammation occurring in an organ. So in this case, I'm showing the lung. There's inflammation that's occurring. Immediately upon that inflammation initiating, there's monocytes that enter the bloodstream, which when patients come to the emergency room, they get an IV administration of our formulation. So the monocytes that have entered circulation take up our formulation selectively as they migrate to the inflamed tissue. Once in the inflamed tissue, the cells that have taken up our formulation are promoting repair in that tissue to lessen the amount of pro-inflammatory response that's occurring. And that therefore limits damage associated with the event. So we have patents covering all sterile inflammatory conditions for our formulation. And we have the Bluegrass Pharmaceuticals has an exclusive option for these patents, as well as new molecular entities that we're currently developing to expand the patent portfolio. So we validated this in a mouse model, and this is a model of severe model of myocardial infarction. This is a left anterior descending coronary artery ligation. And we've tested this in over 100 mice now. And what we see is that when we use our formulation, we have a significant enhancement in survival. We generally lose, in untreated mice, we lose between 50 and 75% of our mice. And when we treat, we only lose about 25 to 30% of the mice. And when we take the hearts out and we look at a cross-section analysis of the left ventricle, we see a significant reduction in fibrosis based on the therapeutic. We've also validated this not only at the University of Kentucky, where this study was started, but also by an additional surgeon at the University of Michigan. So we've now tested this at 2 different institutions with 2 different surgeons. So the space here is very large, incorporating all ischemic and ischemia reperfusion injuries. But we're taking a targeted approach, focusing on acute kidney injury at this point, with an obtainable market of $2.2 billion. And this is driven by aging demographics. It's driven by the diagnostics that are being developed that will help us as we go into clinical trials and help diagnosing patients who are having or who have ischemic events. And it's also becoming established care to integrate such a therapeutic into treatment. So at this point, we're focused on non-dilutive funding through federal grants to establish some of the early milestones and preclinical data that we hope to then have a fundraising round of targeting $6.5 million in 2026. That will get us through phase 1. And other comparative companies that are focused on ischemia reperfusion injury, they've had a significant increase in valuation, and I think this is a $6.5 million ask would be a very nice windfall for everyone involved. So with that, Ben was supposed to be here. He recently had a baby 2 weeks ago, so he could not make the trip. I applaud him for staying with his wife. And he's a former Navy SEAL, and actually he's excellent managing small teams and very strategic operations. And then I'm associate professor at the University of Kentucky College of Pharmacy. And then we've also our other founders. Dave Fiola is a pharmacist and has expertise in lung pathologies. And Ahmed Abdel-Latif is at the University of Michigan and is a cardiologist, interventional cardiologist, and has expertise in heart fibrosis and heart pathologies. So with that, I thank you and happy to take questions.
Wonderful presentation. Thank you so much. I wonder, do you see in your animal studies improvements in cardiac or kidney function after using your strategy? Not only survival, but function?
Yeah, we do. We see improvements in the majority of our data is in the cardiac model. So in the cardiac model, we see improvements in cardiac output, overall reduction in inflammatory markers and reduction in fibrosis that are then leading to enhanced ejection fraction and improved outcomes over time.
Do you have any data on blood pressure or some?
That is a great question. I'm not sure. I can get back to you on that. Yeah.
Thank you so much.
Yes.
From an investment perspective, you shared that you're going to want to go into the clinic in 2026. When do you expect to have the first readout to see how the clinical trial, the phase 1 actually, performed?
Yeah. So we're expecting to get into phase 1 in 2030, and for acute kidney injury. And so I think a primary readout in 2031 is probably a reasonable target for that, if not in 2030.
Hi, nice work. I was just interested. I want to know if these are anti-inflammatory molecules, right? NFC. So there are lots of inflammatory diseases like neurodegenerative disorders and all that. Do you see a broader impact of your NMC? They can cross blood-brain barriers to prevent neurodegeneration?
Great question. Yes, there is absolutely a market outside of the targets that I've presented. We've demonstrated activity in a spinal cord injury. We've shown uptake after traumatic brain injuries. So we have other areas that we are pursuing. From a research perspective in the lab, the company is focused on AKI based on the market and the business perspective of AKI.
That's a great news. I think, do you have a biomarker detecting the inflammation in the blood of TBIs and all that?
We do not. I mean, we've used cytokines as the biomarker.
I do have a biomarker. I'll talk to you about it.
That's great. Yes, perfect.
I'll be giving a presentation tomorrow.
Wonderful.
Thank you.
All right. Thank you so much.
Thank you.